All right, looks like we're recording. Okay. Hello, everyone. Thank you all for joining this afternoon for this live interview with Dr. Tendai Chiware. I'm so excited to have her here to discuss fertility today and reproductive health in general. And a part of one of my goals on my channel was to have interviews and discussions, but also conversations and topics that affect us all as women, but also as Black women. And so I'm so excited to, I'm going to say excited a lot because I don't have another verb to throw out there, but I'm so excited, thrilled to have Tendai here with us to answer some of your questions and some of my questions, misconceptions, and just flat out myths that we've heard in regards to fertility, reproductive health, so on and so forth. So I'm going to, let's see. We're going to start with introductions, and then we're going to start with questions, with the interview questions.
Okay, good. I'm Tendai Chiware. I'm a reproductive endocrinologist and infertility specialist, which essentially is a fertility specialist. I am an OBGYN as well and subspecialized in infertility. I went to medical school in the UK. And then I moved to the US to then do residency and my fertility training.
And also sex education in school, reproductive health, all of the things that affect us that are burdening our communities. We don't have people that we can talk to, whether that be professional or people at home that are educated on the topic. And so my first question to you is, what is the role of a fertility specialist and how does it differ, if at all, from a gynecologist?
Yeah, so as a fertility specialist, I mostly see women who are trying to get pregnant, and some women already have a diagnosis, some of them don't. So I help with fertility testing, and then we find out what the issue is, and then hopefully try and get them pregnant. Compared to an obstetrician and gynecologist is sort of like a women's primary care doctor. They mainly deal with the basic women's issues. They are surgeons as well. So do surgeries like hysterectomies, remove fibroids, things like that. So, your gynecologist is really the person you go to in the first instance when you have any issues. They do your annual exams, they do your pap smears every few years. They're really the first port of call. And then specifically with issues with trying to get pregnant, they would usually refer to us. Oh, I think you're muted.
The conversation of age always comes up. That's like the first thing. I don't know about you, but in my family, if you don't have children by a certain age, people are just flipping walls and lids, and without us having the conversation of why that may be, or if that's an option, et cetera, et cetera. And so I wanted to know, how does my age affect my fertility and chances of a healthy pregnancy?
So I'm originally from Zimbabwe, so I know exactly what you mean, particularly in African families. If you haven't had a child by a certain age, people start asking you questions. But age does play a very important role. A lot of my patients that I see are actually in their 40s, and I feel that a lot of women don't really know that as you get older, your fertility actually does start to decline, and it usually starts its decline around about the age of 35 to 37. Yeah.
Yeah, that's good to know. And I think that the clock is ticking is real, right? And it's not a myth necessarily, but there are women who are in their 40s who, can try to get pregnant. And to when would you say is the best time to, if a woman or a couple is considering pregnancy, when should they start looking for someone to talk to if they are close to 40 or mid 30s?
So once you've been trying for over a year, if you're under the age of 35, or if you're over the age of 35, once you've been trying for 6 months and haven't gotten pregnant, then you should seek some advice some medical advice about that. And then if you are in your 40s, and you have been trying for a couple of months, then it is important to seek advice sooner, just because, as you say, the clock is ticking, so to speak.
Yeah, thank you. So I think as important as it is to talk about fertility and pregnancy, it's also important to talk about contraceptives. And so can you just tell us what are some of the types of birth controls for both men and women?
The most commonly used is going to be condoms, used by men. There are female condoms as well, but not as often used. Then for women can use birth control pills. There are different types of birth control pills. They are hormonal pills. You can have the combined contraceptive pill, which most people know has both hormones in it, estrogen and progesterone. And then you have the progesterone only birth control pill as well. Then there are other longer acting birth control pills, like longer acting birth controls, like the implant that you get in your arm, the depot shot, which is an injection that you get every 3 months, and then also longer acting birth controls like IUDs. So usually there's the hormonal IUD or the copper IUD that most women will use. Some people also use other methods of birth control, like the withdrawal method. Some people check their body basal temperature and avoid sex around that time. Some people check their discharge and things like that, and natural ways of birth control.
Got it. And with all of those types of birth controls, what are some of the risk factors associated with them?
So, for instance, if you're taking the combined birth control pill, some people who suffer from migraines with aura should not really be on that type of birth control. So that's usually when you go and see your doctor, they'll go through your medical history and then decide on which birth control would be the best option for you.
Particularly in this case, if a woman who is trying to get pregnant and she comes off birth control, what's like the time frame she should consider, or how fast can she get pregnant after she's off birth control?
So it really depends on which type of birth control you're on. Birth control pills, sometimes it can be up to 6 months to a year before you start ovulating. Sometimes if you have the depot shot, in particular, that's one of the worst offenders for women to then start their natural ovulation cycles after stopping it. With the IUD, like the Mirena IUD or the copper IUD, you're pretty much ovulating while you're on it. So those ones are really the ones that you can pretty much get pregnant as soon as you stop using it.
That's great.
Birth control pills are the most common that most people will have used prior to trying to get pregnant.
I guess, is it easier in terms of just application, easier to use, it's not invasive, or
it's easy to use. I think it's one that has the least sort of myths associated with it. A lot of people don't like the IUD because their mother tells them the horrible stories of how the IUD got stuck in them and couldn't be removed. And I always tell patients when I'm talking to them about contraception and they don't want to get an IUD, I always say to them, well, the IUD has changed. It's progressed over the years, just like the iPhone that you had 10 years ago is completely different from the one that you have now. Similar, it's exactly the same with birth control. Everything is changing, it's moving. We know a lot more about these different modes of contraception now.
Yeah, definitely. I've seen some horrible pictures and memes of babies coming out with IUDs in their, or I don't know if it's an IUD in their hands and all kinds of interesting.
Yeah. I have delivered a baby where the IUD was stuck on the placenta. Yeah.
Oh, lovely surprise.
That's how you got pregnant. Yeah. Work.
And those are really rare cases, right? That's not a common thing. Super.
Yeah. Each mode of contraception does have a failure rate. So, the IUD is one of the lowest ones. It's almost as successful in stopping pregnancy as having sterilization done. So, each one with the correct use has its failure rate.
Awesome. Thank you.